Hi, my name is Kallio Hunnicutt-Ferguson. I am a clinical psychologist with Emory University School of Medicine, and I am a prevention specialist with the Emory Center for Maternal Substance Abuse and Child Development. I'm here to talk to you today about maternal alcohol use and its impact on children. Just to acknowledge some of the funding sources for some of the material presented today, and I have no conflicts of interest to report. This webinar will review the definitions of substance misuse and substance use disorders. I will provide information about substance use disorders in women in particular, and discuss rates of alcohol use during pregnancy. Finally, I will provide information about the impact of alcohol use on the developing child. So the majority of the population uses some kind of addictive substance, even if it's only caffeine. So we think of substance use problems on a continuum from mild to severe. The Diagnostic and Statistical Manual identifies or defines substance use disorders as a cluster of cognitive, behavioral, and psychological symptoms, indicating that an individual continues to use a substance despite significant substance-related problems. This can include repeated unsuccessful attempts to cut down on one's use. It can also include continued use despite its consequences. We need to look at, in substance use disorders, the impact of or the engagement in risky behaviors such as driving under the influence, and necessary for the diagnosis of a substance use disorder, there needs to be impairment in functioning. Though substance misuse and addiction are not terms used in the DSM, I just briefly review them today because they are commonly used. Substance misuse refers to usually using an illegal substance or using a prescribed medication in a way other than what has been recommended or in ways that negatively impact one's functioning. And addiction is a term that was eliminated from the DSM because of its uncertain definition as well as its potential negative connotations. So there's an effort to destigmatize or not eliminate the use of stigmatizing terms. When the term addiction is used, however, it usually refers to the more severe end of the spectrum of substance use disorders, usually with physiological dependence on a substance. That can include someone showing tolerance for a substance or needing more of it to get the same effect. Can also include experiencing withdrawal symptoms in the absence of the substance. When we look at how substance use problems affect women's health, research shows that women are harder hit by substance use problems than men, and this can be called the telescoping effect. And it was actually first identified in relation to alcohol use. Although women tend to use at lower levels than men, their substance use escalates more rapidly into substance use problems and substance use disorder as compared to men, and the physiological effects are more severe. For example, women have a higher blood alcohol concentration with the same amount of alcohol used due to their total body weight and water concentrations, as well as lower activity of certain alcohol metabolizing enzymes. They also have worsened health effects, including increased risk of cancer like breast cancer, fertility issues, greater risk of liver disease, heart damage, and increased risk of mortality. Women may also be less likely to seek treatment due to a variety of reasons like stigma, competing childcare responsibilities, lack of representation of women in treatment facilities, among other reasons. Now, this figure depicts alcohol use among women in the past month. So we see about half of the US population is using alcohol on some level or reports using alcohol on some level in the past month. And then when we're looking at alcohol use specifically in pregnancy, the good news is that we see significant reductions in both alcohol use generally, as well as binge drinking in particular. It's important to look at these numbers, however, because about half of all pregnancies are unintentional. And though many women who are intending pregnancy do reduce their alcohol use, women may still be drinking before they know they're pregnant. So similar to other substances, again, we see less alcohol use, but still about 10% of women are continuing to report alcohol use during pregnancy. Now, when we look at the developmental effects of prenatal alcohol exposure, they are wide-ranging and potentially quite severe. There are perinatal problems like preterm birth, physical birth defects, growth retardation, global cognitive effects, and as well as academic deficits that have been seen. Other effects that have been seen, again, preterm birth, we see increasing in risk as the number of drinks per day consumed increases. Alcohol-related growth retardation is seen. Alcohol may affect weight, length, and head circumference. This may be persistent or gradually resolve, and it is often most evident in the neonatal period. Fetal alcohol spectrum disorders are perhaps the most severe consequences of prenatal alcohol exposure. A recent study looking at FASD in first grade children across the United States found that the most conservative prevalence estimates ranged from about 1 to 5%. This is the equivalent of about 11.3 to 50 per 1,000 children. So these findings really represent a higher estimated prevalence for the US than has been previously reported and is consistent with studies carried out in Europe and Africa. We do know that FASD does last a lifetime. So it includes profound primary disabilities, including intellectual deficiency, developmental and learning disabilities, cardiac problems, vision and hearing loss, facial dysmorphia, along with secondary disabilities that result, including school failure, vocational failures, legal problems, and increased risk of substance use problems. Successful intervention strategies do exist, and they include, most importantly, early diagnosis and treatment, dealing with the child as an individual, educating parents about the disorder and its brain base and involving parents in treatment, educating interventionists about the disorder and its characteristics so that they may be watching for it or looking for the signs so that they can refer as needed, helping children learn to control arousal levels, so learning self-regulation skills and using behavioral learning methods. In conclusion, maternal alcohol use can have profound and lasting impacts on the developing child, as risk factors, causes, and treatments are complex and requires treating women and affected children with compassion and reducing stigma. Interventions do exist to help affected children, and it is best to intervene as early as possible. So we would love to connect. Thank you so much for listening today. I've listed our email address and website here, and please leave us feedback using either the QR code or the link listed below. Thank you again for joining us.